There's I mean, we have no idea what long-term testosterone use does to a female's body at 10 to 40 times what her body would normally have. Okay. We don't know. We can talk about the risks, but we don't know. But it's not presented to people as a highly experimental medicine, which it is. It's not reviewed by an institutional review board. They make it sound like it's something you can just sign a waiver for and no big deal.
Why is that? Why is there no review? Why is there no oversight? Why is this so free and loose? I mean, is it a sign? Is it a good sign that we're like more progressive now, more open-minded, but because of that, things have gotten a little slippery in terms of what we celebrate and what we should rationally step back and objectively analyze and say, hey, is this really the right way to handle this?
I think one of the things that happened was in 2012, WPATH, which is the Transgender Health, organization, worldwide organization, changed to an informed consent model, saying that people should be able to get the drugs they want or, claim to need based on their own recognizance. You sign a form, you're aware of the risk, and then you get it. And the problem was maybe they felt that there was too much gatekeeping, as they call it, or too much questioning. They felt, that there were people who weren't getting the medical care they needed. The problem was you hit 18, and the age of medical consent varies by state. In Oregon, it's 15. It varies. And you hit that age, you can get it. You walk out the door with it.
In Oregon, it's 15?
Yeah.
That's crazy. You're not even a fully formed person.
No. And you don't need your parents' approval.
Oh, my God. We were talking before we got on the air about children, like really young children transitioning. You were saying that most people who transition know when they're very young. That is a real... That's a hot button topic for people, children and hormone blockers and children. Yeah. What I keep going to is if you are a woman and you know you're a woman, why do you need to get these hormones injected into your body? Why can't you just be a woman? I'll call you a woman. Like what are we doing with all these hormones? Like why are we imagine you're a person who says, I need to transition to be a woman, and I know that I need a chemical that I've never had in my body before. And if I get that chemical injected, then I'm going to be happy.
Right.
And if I get surgery, then I'm going to be happy. This is what I'm supposed to be.
Right. So the big problem with this is that you're making all the decisions that normally a doctor would make.
And you're doing it at 15.
Right. In any other area of medicine, a doctor makes that. They say, hold on, I know you think you need, whatever, an opioid, but just relax. Let's see what you're, that's... effectively what facilitated the opioid crisis. Doctors just handing over the prescription pad. And we're seeing that right now with anybody who claims to have gender dysphoria. They get it. They self-diagnose. They say, no, I know it's my problem. They don't have a mental health professional who says, oh, wait a second, hold on. You have very high anxiety, depression. You have a lot of other mental health stuff going on. Let's deal with that first. Any therapist who dares to say that might violate one of the 19 conversion therapy laws we now have in 19 different states.
There's 19 conversion
I think it's 19,
therapy?
Yeah, which bans so-called conversion therapy, even on gender identity, which means that therapists could lose their license if they say, hold on, I know you want to transition. I know you think your problem is gender dysphoria. Let's talk about some of your other problems.
Wow. So a therapist, if you're a 15-year-old kid and you come to a therapist and you say, all my friends are going trans and I think I'm trans too, the doctor has to essentially go with you on this little path you're on?
The doctors feel that they have to. I mean, the number of associations, American Medical Association, Endocrine Society, I mean, you name it, American Pediatric Society, all these medical professional organizations, most of them have adopted affirmative care, which means their job is to affirm the patient's self-diagnosis with regard to this one issue. I mean, it's turning doctors into, life coaches, right?
How much time have we been doing this for? How long is the time period when this really started to escalate?
The last decade. We've seen it fly across the West. I mean, it's in Canada, UK, Scandinavia. We're seeing numbers across the West. All of a sudden, it's teenage girls. It's the very same girls who spread every other, contemporary hysteria or every other hysteria.
Boy, it makes you feel like there's a lot of lawsuits coming.
I wouldn't be surprised. I mean, these girls are getting these things so easily, and they're 15, they're 16, they're 17, they're 18.